Good morning. Thank you so much for joining us and for lending your expertise to the Health Policy Institute of Ohio's Health Measurement Advisory Group. I'm Ree Malley, the Vice President of Healthcare System and Innovation Policy at HPIO, and both myself and Amy Bush-Stevens, Vice President of Public Health and Prevention, will be facilitating HPIO's work around this advisory group. We are very excited to be convening this group again to develop the 2019 Health Value Dashboard. And we really wanted to thank you in advance for your interest and participation in this work. While most of you are familiar with HPIO, we know that a few of you are new to this advisory group. So just as a bit of background, we are a small nonprofit organization, and our mission is to partner with policymakers and other stakeholders to provide the independent, nonpartisan information and analysis needed to create evidence-informed state health policy. HPIO was founded in 2003 by a number of foundations from across the state, who, along with the organizations that you see here, provide us with core funding for our work. I mentioned we are small. We are a staff of 9. You can see all of our staff here, and we work very closely together on various initiatives, projects, and publications. You will be working very closely with both Amy and I, but other staff at HPIO as well. Just to go over the agenda briefly, you can see it here on your screen. I'm going to be doing a quick Dashboard 101 for our new folks in the group. Amy will talk about the 2017 dashboard activities and impact. I'll be reviewing the process and timeline for the 2019 dashboard, and then we'll discuss some opportunities that you have highlighted for us to improve the effectiveness of the 2019 dashboard. We do have a health measurement advisory group page that is currently live on the HPIO website. If you go to www.hpio.net and click on groups, you can see the advisory group page there. We will provide information and materials from advisory group meetings. The agenda for today's meeting is already posted, but we will also post a recording of the webinar later this afternoon. If you have any questions about meeting logistics, please feel free to email our manager of education, Alana Clark, and she can help you get connected. Our objectives for today's meeting are listed here on your screen, and they really follow closely with the agenda. So we will review the objectives of this advisory group, review the dashboard activities, 2017 dashboard activities and impact, the process for developing the 2019 dashboard, and then again discuss some feedback that you all provided regarding opportunities for improving the effectiveness of the 2019 dashboard. All right, so for those of you who are new to this dashboard journey, I did want to give you a little bit of background. Our first health value dashboard was released at the end of 2014, and we released the second edition of the dashboard at the beginning of March of 2017. Our organization has made a long-term commitment to updating the dashboard every 2 years. With the help of this advisory group, we will begin developing the third edition of the dashboard, which we plan to release in early 2019. The dashboard is a tool that we developed with input from many of you and other stakeholders to track Ohio's progress towards health value. This is the conceptual framework for the dashboard. And you can see that we define health value as the combination of improved population health outcomes and sustainable healthcare spending. The dashboard also acknowledges the various systems and environments that impact health value, including the healthcare system, access, public health and prevention, and the social, economic, and physical environments. The last edition, or the 2017 edition of the dashboard, had 118 metrics to track Ohio's performance across all 7 of these domains. I think the first edition had slightly larger number of measures, so maybe we can keep decreasing the metrics little by little over time. We are always working to align the dashboard with national rankings and scorecards, such as the ones that you see here listed on your screen. But what makes the health value dashboard different is really this unique focus on health value. We also have a much more comprehensive view and analysis of all of the systems and environments that affect health. We include spending in the health value dashboard, which is often an area that is not included in other dashboards and scorecards. And then our intention is to make the dashboard concise and in an at-a-glance format for a policymaker audience. I do want to emphasize that the dashboard really is intended to inform the work of our state policymakers, and many of you use information in the dashboard for your organizational purposes as well as relaying information to state policymakers. We know that improving health and addressing healthcare spending are concerns shared by policymakers and others, and so we believe that collecting this publicly available data in one place is an important starting place to point us in the right direction and to build a framework for accountability and understanding our performance of health and spending in Ohio. Here you see our dashboard logic model. Our short-term outcomes include that policymakers have a tool to track Ohio's progress in improving health value, and that they are motivated to address Ohio's health challenges, and that public and private stakeholders have a uniform set of metrics and a common understanding of health value in the state. And then in the long term, what we'd like to see is that policymakers make informed health policy decisions, and that both public and private stakeholders implement effective strategies that lead to improved population health and sustainable healthcare spending. You will note that we have had a greater focus on highlighting evidence-based strategies to address Ohio's health challenges through the various iterations of the dashboard, and we hope to make that stronger in this third edition as well. So we'd love to get some of your feedback on that. The dashboard does put data into context by looking at Ohio's performance relative to other states, tracking change over time. In this second edition of the dashboard, we also highlighted some of Ohio's greatest health disparities and inequities, and this was really a new component that we added and that we hope to keep for this third edition of the dashboard. And in case you missed our many presentations throughout 2017, and we're wondering how Ohio does, as you all know, we do poorly. So we rank 43rd on population health, 31st on healthcare spending out of 50 states and the District of Columbia, and our health value rank, which is a composite measure of both our population health and healthcare spending ranks, equally weighted, and again, relative to other states and DC, we rank 46th, which puts us in the bottom quartile. That means that Ohioans are living less healthy lives and are spending more on healthcare than people in most other states. And with that, I will shift it over to Amy to talk about what we have done to disseminate information in the dashboard and what we have tracked as far as impact.
Good morning, everyone. This is Amy Stevens at HPIO, and I'm going to talk about the results of our evaluation, our internal evaluation of the 2017 dashboard. So first, we'll take a look at some of the outputs and dissemination activities from 2017. We released the dashboard on March 1st of 2017 at a forum that was attended by 142 participants. We also hosted a webinar that had almost 100 participants. Throughout the year, we did 38 presentations on dashboard content around the state, and we also hosted 5 regional forums that included dashboard content with a focus on equity. So you may recall that in the 2017 edition of the dashboard, we added the equity profile section, and so we really emphasized that at those regional forums. There were 16 media stories that referred to the dashboard in some way in 2017, which was great. And we had 6,175 page views on the dashboard website, which is quite a bit higher than the average for our HPIO publication pages, which is a little under 2,000. We also made sure that we were getting the dashboard information directly into the hands of our legislators. So one way that we did this was through legislative testimony. So we did testify twice in hearings during the state budget process, and then once also for a legislative task force. And then we were able to document 7 examples of times that people from other organizations referred to the dashboard when they were doing their own testimony during the dashboard process. And it's certainly possible that there were additional examples of that, but those were the ones we were able to capture. In addition to this formal testimony, we also met one-on-one with many legislators throughout 2017, and we always share the dashboard with them as a way to engage conversation about our work in general, and also as a way to spark conversation about the social determinants of health. These are results from our annual stakeholder survey that goes out to everyone on our mailing list. And we asked them what were the most useful publications for influencing the policy-making process. And you can see that the Health Value Dashboard was cited as the most useful publication. And this was also true for the 2014 dashboard. So this is really a foundational document for our organization, and we're really happy when we see that people find it useful to inform the policymaking process. Here are a few comments from stakeholders about the dashboard. This first one is from Representative Romanchuk, who is the chair of the Finance Subcommittee on Health and Human Services, which is important during the budget process. He said, the dashboard has really become a go-to report. Now it's part of the fabric of what we do. And then a comment from a survey respondent, the health dashboard is the benchmark for conversation around population health issues. And I think the health value dashboard has influenced policy considerations at the state level. Now we'll take a look at results from the dashboard evaluation survey. This is the survey that we sent out to all of you a few weeks ago. We also sent it to our board and to folks who came to the dashboard forum in March. And here we were asking how your organizations use the dashboard in your work. And you can see that the most common use was to set priorities, either at the community level or at the organizational level. And that's actually how we use the dashboard in our work as well. We look to the greatest challenges identified in the dashboard to help us set priorities for our forums and publications, for example. And you'll see down at the bottom of this slide, much lower percents for educating policymakers and advocating for issues or lobbying for specific legislation. We realize that not all of our stakeholders do this kind of work with advocacy or lobbying. But if you do this kind of work in your organization, we really look to you as helping us to get this information in the hand of policymakers, so we can really use your help in getting the word out to them. This slide is asking questions that really get at our performance on that logic model for the dashboard that Reem shared earlier. And you can see that it looks like the feedback is telling us that the dashboard is doing a great job of providing a tool for tracking progress towards health value and for having a set of metrics and raising awareness, but is less successful in motivating action. So those 2 bars down at the bottom there. So that's really our challenge with the dashboard in 2019, is to take it to the next level. And the theme of these 2 last slides is that you can lead a horse to water, but you can't always get the horse to drink. So our challenge for 2019 is really translating from data to action. and we would love to get your input on how to do a better job of this. So I'm going to take a moment, and if you could find the chat box and send us your suggestions for how to motivate policymakers to use the dashboard, and how you and other stakeholders can help us to do that. So please take a moment to type in your suggestions. We are going to keep going, but we definitely appreciate having your comments here, and towards the end, if we have time, we might share out some of those. And now I'm going to turn it back over to Reem.
Thank you, Amy. All right, so I am going to be talking a little bit more about the process for the 2019 dashboard and what our timeline looks like. Again, here you see the conceptual framework for the dashboard. We have work groups for each of the 7 domains that you see in this conceptual framework, and the work groups really provide us with input on which metrics we should be tracking in each of these domains. There was quite a bit of robust work that happened with the 2014 dashboard around the selection of metrics, and some more work and discussion with the 2017 dashboard. We are likely not going to need to have such an in-depth discussion with the 2019 dashboard, so I'll talk a little bit more about what the work of the work groups is going to look like in just a little bit. Now, similar to the last edition of the dashboard, we do plan to keep these key elements of the dashboard for the 2019 edition. So we do want to rank Ohio's performance relative to other states. We want to indicate progress and trends. We, in the second edition of the dashboard, that 2017 edition of the dashboard, we did highlight most improved states. We know that this is an area that sometimes we have other suggestions for. So we would like to have some way, again, to put data in context for state policymakers, highlighting what's most important to them. So we may have a bit more discussion about this, particularly in the second advisory group meeting. And then we would like to keep a component around disparities and inequities and refine that even more for this third edition of the dashboard. As with our second edition, we have partnered with researchers at the Ohio University for help with data compilation and analysis. And so you will see some familiar faces with OU again for this third edition of the dashboard. And here you see the objectives for the Health Measurement Advisory Group for this year. We will really be looking to you all for input on ways to improve the effectiveness of the dashboard, getting it in the hands of state policymakers, and really helping to have them use this work to inform their health policy decisions. And you've provided some suggestions already through the survey on how we can do that, and Amy will go into that a little bit more as well. We will be looking to you for input on which metrics need to be updated, replaced, or added to the dashboard, and then also for giving feedback on methodology, layout, design, and dissemination. We do have a very solid methodology for the dashboard, but there might be some areas where we may want to tweak, and we may have some members of the group that have specific expertise in this give us feedback on that in particular. And then with layout, design, and dissemination, those are all areas that we will discuss as we begin our data compilation and analysis. We are happy to have 45 members confirmed or committed to participating in developing the third edition of the dashboard. And this number is actually a little bit higher now as we've had a few folks join in just the last few days. And then we also have a very diverse group of stakeholders that are taking part in this advisory group as well. And you can see the different sectors here on your screen. Now, over the years, we have become much more intentional about reaching out to sectors outside of health to be a part of our work and to inform the work that we do here at HPIO. You'll note that there are some sectors here with no representation as of yet. And this is because we have actually expanded our stakeholder list. And so maybe these are areas that we weren't so focused on with the 2014 edition, and now we really would like to have representation from these sectors. We have some ideas of folks from our previous work that we think would be great additions to the Health Measurement Advisory Group that represent these sectors. But if you have any recommendations, please take a moment and type them into the chat box. Or you can email myself or Amy with some of those recommendations. Again, we do want to be very intentional and reach out to sectors outside of health to be a part of our work, particularly given the broad scope of the dashboard in examining the various factors that influence health outside of not just the healthcare system and access to healthcare, but including our social, economic, and physical environment. And here you see the timeline for the 2019 dashboard, or this third edition. It really feels like yesterday that we were working on developing the 2017 dashboard. I know that some of you may share those same sentiments, but we are on our way to now the third edition, which is really just so wonderful from our perspective, and we're so happy that many of you have stayed the course with us through this journey over the years. We plan to review and finalize metrics by the end of May, so in just a few months, and we will be looking to the work groups to provide input on our final set of metrics. And I mentioned that we may not need to have as robust of a conversation as we've had in previous editions, because we really are looking to keep consistency across the various different editions of the dashboard. So that will be an underlying consideration for the work groups, but we'll be looking to see whether the metrics are still available, whether data has been updated, and with that in mind, whether there are any changes that need to be made with the metrics. And then we will be really in the data compilation and analysis phase with Ohio University beginning in June. And then through the end of the year, we will be compiling and analyzing data on a rolling timeline as that data becomes updated and is made available to us throughout the year. I'll also note here, and just as a reminder to those that have been with us throughout the years and those of you that are new to the group, that the dashboard relies primarily on publicly available data. And so we want to make sure when we do our work in the dashboard that we are using the most recent publicly available data for the metrics that we have in the dashboard. What we realized last year is that meant that we did have to extend this phase a little bit more into the first part of 2019. And so you may see that the data compilation analysis piece is taking a little bit longer the previous years, and that's because we do want to make sure that we always are getting the most recent data. And sometimes some of that data is not released until the end of the year, so in December 2018. We plan to have the second meeting of the Health Measurement Advisory Group around September or October, and that meeting will really be focused on the layout and design of the dashboard. At that point in time, we hope to have a few mock-ups for you all to review and provide feedback on. And I want to note that that is an in-person meeting, and it will likely be held here at HPIO. And it will provide you all with an opportunity to give some feedback on really the layout and design of the dashboard, and then some of our dissemination efforts. And then finally, we will be planning to release the dashboard and beginning our dissemination and presentations and testimony at the beginning of 2019, so within that Q1 of 2019. Here is another illustration of the different work groups we will be convening throughout the year. You will see that we have those 7 domains that will really be providing input on metric selection. We also will have our health equity work group. And when we need to, we may pull a few of you into some discussions around methodology as well. We are really excited that we have good representation across all of the work groups. So you can see here, the folks that have volunteered to be a part of the work groups, and we typically combine the social, economic, and physical environment, and we'll likely reach out to a few more folks to be a part of that physical environment work group. But we wanted to thank you for your willingness to not only participate in the health measurement advisory group, but also dig a little bit deeper in selecting metrics or helping provide input on the metrics that will be included in dashboard through these work groups. And then finally, before I hand it back over to Amy, I did want to mention that we are very intentional about keeping consistency across the dashboards over time. So that will be an underlying consideration for our work throughout this year. With that said, we certainly want to build upon and improve the effectiveness of the dashboard, and Amy will talk about that a little bit more.
All right, so the last thing we wanted to address on this webinar was suggestions for how to improve the dashboard for 2019 to make it even more effective. And going back to the results of the dashboard evaluation survey, first we looked at the usefulness of specific components of the dashboard from last time. And you can see the top 4 most useful components. So these were rated as very useful, were the list of greatest health value challenges, the trend section, the guide to improving health value page that accompanies the dashboard and points to strategies, and then the equity profile section that we added last year. So we'll definitely want to maintain those core components of the dashboard. And then we asked on the survey, if resources and capacity were available, what added dashboard features would be most useful for reaching state policymakers and influencing the policy-making process? And there's a lot going on with this slide, so we're actually going to split it into 2 themes here. So the first theme, back 1 slide. Okay. The first theme here is suggestions to provide more direct and specific information about evidence-based strategies to address the challenges that we highlight in the dashboard. So in the 2017 edition, we had 2 pages in the dashboard that talked kind of generally about approaches most likely to improve health value, and then we linked to the guide to improving health value where there was more specific information. And what this feedback is telling us is really leaning towards a more direct and specific approach to providing kind of when we see the troubling ranking that we have for health value, kind of pointing to the specific things that we could do to improve our ranking in health value. And being more direct and specific about this certainly has some pros and cons for us as an organization. So we're going to be working through how best to do this, but we'd love to hear your suggestions if maybe you have seen examples from other publications or other organizations about an effective way to do that. We'd love to hear from you on if you think this is a good idea to be more direct and specific. And then the next set of responses here, I'm just going to highlight the top 2. So the first one was about local data. And as you probably know, the dashboard focuses on state level data, and we don't actually include local data, but we have a crosswalk where we link to where that local data is available. There is a lot of overlap with county health rankings, and so we always kind of point folks in that direction to get county level data. Pulling local level data and checking it and displaying it adds many, many more data points. So that is really a challenge for us. But we will certainly think about if there are some ways that we could, if there's some ways that we can pull in more of a local focus for the dashboard this year. And then the next point here is about dissemination and sharing tools. And we're definitely excited about always coming up with new ways to get the word out about the dashboard. And so we want to take a minute here to have you use the chat box to give us your suggestions. So what ideas do you have for us for 2019 for getting the word out about the dashboard? And it looks like we have a chat, which I can't see. Just a minute here. No. All right, well, take me a minute to see the feedback here. So again, we're asking you for your suggestions on dissemination and other ideas for improving the dashboard in 2019. And it looks like we have had a few people type in some comments.
Okay, I am switching. This is now Reem Alley, just to take a look at the comments. I think we were having some problems with Amy's screen, but many of you have listed a number of ways that we might be able to reach out to policymakers. So we have the mention of a companion document to accompany the dashboard. Also publicizing what we can do to get the word out about the dashboard and spur action through small group meetings, larger forums, or regional meetings. And we did do a little bit of that throughout 2017. And so we can certainly think about how we can implement that more with the 2019 dashboard. And also, and we're going to try to still get this up on Amy's screen so she can see it as well. And we're also going to be similarly to what we did with the 2017 dashboard, targeting legislators through mailings. And so that was one of the suggestions, is frequent mailings to legislators and including the summary dashboard. So that's great. That is something that we do, but we can certainly ramp up as well. And then another suggestion is that we host an event to discuss issues raised by the dashboard involving gubernatorial and other state legislative candidates. And I think that's something that we consider. We've had discussions about how to best disseminate information in the dashboard to our gubernatorial candidates and other legislative candidates. And I'm going to now transfer back to Amy to help guide this discussion a bit more.
Okay, and wanted to close by sharing a few quotes that I think from the survey that I think nicely summarize the feedback that we got and describe our challenge for 2019. Let me go to the next slide. So one person said, the tool should be used to focus the work versus boil the ocean. And boiling the ocean is certainly something that we've heard before. It's always a challenge for us. And the second comment here was to continue to simplify the path between sets of indicators and sets of policy changes that would make the most difference. So again, as you if you can think of additional suggestions for how to help us do that, to really translate from data to action. And we've got a few more comments here. A bunch more comments. Okay. So some suggestions for specific organizations to reach out to for our physical environment group, which is great. Thank you for sending those suggestions. Okay. Suggestion of another scorecard to look at, the AARP Long-Term Care Services and Supports Scorecard, which has some examples. They identify areas of best practice, so we will definitely take a look at that. And as you come across things like that that you think are useful examples, please send those along to me or to Reem. Suggestion for press releases to newspapers, perhaps with local legislator comments on their interpretation of the dashboard. That's a really great suggestion. We do reach out to newspapers, but I don't think we've gotten comments from legislators in the past. So that's an exciting idea. And let's see. Okay, suggestion on a specific topic to include. Syringe services. Okay, some more specific information about tobacco strategies. Send out in synchrony with the county health rankings release from RWJ, and to focus on possible actions that could be taken at the local level. Very timely, since that will be released next week. And again, an idea around gubernatorial candidates. Great. Well, these are helpful suggestions, and I'll just talk quickly about the next steps for the dashboard process. So you'll be hearing from us soon about the metric selection work groups. We'll be reaching out to you if you signed up for one of these groups to see if we can come to consensus via email. For some of the domains, there might be more to work through, and so we'll set up a go-to meeting to have more discussion. What we're doing now is reviewing which metrics from last time are still available and have updated data from the last edition, and that will give us a good sense of how much continuity we can have. For the most part, we are going to be able to continue with the metrics that we had last time, but there are a few kinks, a few changes that we'd love to talk through with you. And then we will be having an in-person meeting in the fall, so you'll be hearing from us about that soon. And we'll take a few minutes now to see if anybody has any questions. So please use your chat box to share any questions that you have about the process, or you can continue sending in your ideas and suggestions for making the dashboard even better in 2019. Okay, so another idea about linking and alignment with county health rankings and gubernatorial candidates. So those are definitely two themes. All right, I'm not seeing any additional questions, but you have email addresses for Reem and for me, and we are always happy to hear from you. So please reach out if you have any suggestions or questions, and have a wonderful rest of your day. Thank you.